Good evening. My name is Professor Dr. John George. I am a consultant musculoskeletal radiologist with an interest in doing regenerative injections for joint pathology. I was previously working at the University Hospital in Kuala Lumpur, UMMC, and was a professor there for nearly 23 years. I'm also a consultant musculoskeletal radiologist at the National Sports Institute. My expertise is a diagnosis of a joint pathology using both musculoskeletal ultrasound and also MRI. Ultrasound is particularly useful because patients can point to the place that they are having pain in the joint, and we can put the ultrasound probe exactly over that area to find out what is the actual cause of the pain that the patient is having. This is very useful because we are able to identify the actual cause of pain from where the pain is originating. There are many causes of pain in joint. For instance, in a knee joint, pain can be due to the tendons, or it can be due to the ligament, or it can be from the actual cartilage that is worn out. So we are able to diagnose using ultrasound most of the superficial structures, which are usually tendons and ligaments, and look for conditions like tendinosis, which is clinically known as tendinitis. We can look for other causes of pain as well, which are ligament tears. And with MR and ultrasound, we can also detect loss of cartilage in the knee or other ankle joints. In the shoulder, we are able to look for rotator cuff tears. This is the most common cause of pain in a patient in the shoulder because they may have a torn rotator cuff. I see the role of imaging and regenerative injections as somewhat in between that of rehabilitation, that is, a person who has been having physiotherapy for some time but not getting better, and also the second step, which is surgery. There are many patients who are not keen to have surgery, especially when the tendon tear is not a very large tear, and they would prefer to have another treatment. The same thing occurs with osteoarthritis. With osteoarthritis, it is possible to regenerate the cartilage using regenerative agents like stem cells and also PRP. TDocs has its own certified lab in which produces the stem cells and also exosomes, which can be injected into the joint to regenerate cartilage. Other options for regenerating the cartilage include PRP, which is platelet-rich plasma. One thing to note, though, is that there are different types of PRP, and it is important to use the correct type of PRP when treating conditions around the joint. As far as possible, they should not contain too much white blood cells, as this can inhibit the healing. So we are very selective in the type of PRP that we use, and we also inject the PRP under ultrasound guidance to the location, exact location where the tear or tendinitis is. This ensures that the PRP is injected correctly in the location of the pathology, and this results in good healing. In general, over the last 200 cases that I have injected, what we see is that patients with pain scores of 7 to 9 out of 10 often have their pain scores reduced from 0 to 2 within 6 weeks of the treatment. Also, the function of the joint, if it's only 1 or 2 out of 10, improves to around 8 to 10 or back to normal following the injection of the regenerative injections. Apart from stem cells and PRP, there are other treatments such as HA or hyaluronic acid, which is injected. Hyaluronic acid acts like a lubricant to the joints because when you get osteoarthritis, the synovial fluid reduces in density, and therefore the hyaluronic acid restores the molecular weight of the synovial fluid and also acts as a lubricant to the joint, reducing the pain. We can also inject steroid into areas of bursitis. Sometimes the shoulder pain or other pain may be due to bursal inflammation, for which we inject steroid. All in all, the first and most important thing is accurate diagnosis with a musculoskeletal ultrasound or MRI, which we can do at TDocs. Then, once we know the diagnosis, we will be able to recommend rehabilitation or regenerative injections, or in some cases, the patient may need to go directly to surgery. With 20 over years of experience, I am able to provide an accurate diagnosis and also give the correct recommendation for treatment for your joint symptoms and joint pathology. So in summary, we provide a full-scale service for orthopedic diagnosis using ultrasound and also regenerative injections at TDocs currently.